Hi, I'm Natalie from OT and this is Kelly from PT, and we're here to kind of show you some quick tips and tricks to transfer someone from a bed to a Stryker chair using it as a cardiac chair to help mobilize our patients a little better. So we're going to show you a 3-person transfer and a 2-person. So Kelly, be the lovely patient. The important part when using the Stryker chair is make sure it's all the way flat. The controls are on the side, it can walk you through it. And then when you're going from the bed to the chair, you want to have a little bit of a downward hill just to make it a little easier. So I'm going to raise the bed up a little bit. And then we find it's easiest to use the transfer training board or the transfer board just to make everything slide a little better. It also helps if you have a draw sheet under your patient to help slide them over the best. So with 3 people, I'm going to be the first one rolling the patient. And Mario and Carr, you're going to place the transfer board. And then I'm going to stand this side, they're going to pull the sheet, and I'm going to help to get her on the transfer board. 1, 2, 3. Then we're going to pull the transfer board a little bit over to bridge the gap. 1, 2, 3. And then we will just slide her over with the sheet. 1, 2, 3. And then you pull it out. And then you can set her up in the chair. Then when she's going to go back, you want to make sure to lower the bed in its lowest position so you're going downhill again. And you guys can roll her, I'll place the board. And then we'll switch and put the 3rd person on this side to help pull. And then Kari, if you come over. And we're just going to pull her onto the board. 1, 2, 3. And a lot of times the transfer board will come with you. That's okay, it's actually to your benefit because now it's already bridged the gap. We just have to pull the sheet to pull her over. 1, 2, 3. And then you might need a slight roll just to get that board out from underneath. So that's a 3-person transfer. Now we'll show you a 2-person transfer. And we're going to switch out patients to show you that it can be done with pretty much any patient. So I'm going to raise up the bed again. Okay, I'm going to roll Mario. And I like to put my hips kind of at his hips in case he's going to roll a little bit or lose control, then I'm blocking him. Alright, then we're going to roll him on. Then I'm going to come over to help Kelly for a 2-person to slide him onto the board. Let me just get this sheet underneath. Okay. 1, 2, 3. Good. And then you might need to pull the board a little bit. 1, 2, 3 to bridge that gap. And then 1, 2, 3, slide them with the sheet. And then when you're going back with the 2-person, 1 person's going to roll. We'll place that board underneath. I'm going to lower the bed again to make sure it's in the lowest position, so we're going downhill. Then with 2 people, you want both of you on the pulling side, now that they're stable on the board. 1, 2, 3. And the board came with us, so that's fine. It helped bridge the gap. We're going to pull with the sheet. 1, 2, 3. And if the board ends up underneath them, you can always just roll with the sheet again and pull it out. One other thing to note, if you have an air mattress, it's best if you leave it inflated for pulling them back and forth. Even on auto firm will help because that'll keep it a little more firmer for the transfer. But hopefully that will help give you a couple tips and tricks to transfer patients a little more easier. Thank you.